Health experts are dubbing London the TB capital of Western Europe as they battle the looming crisis of rising numbers of cases each year. Tuberculosis is worryingly becoming increasingly resistant to drugs, as fears grow that the golden age of antibiotics is over. In London alone, there are 3,500 new cases of TB diagnosed each year.
London's got more cases of TB every year than Belgium, Denmark, Greece, the Netherlands and Norway combined. 3,500 new diagnoses every year.
Rates of TB among the homeless are particularly high and account for 40% of all cases in Britain. Delayed diagnosis, reduced immunity and overcrowding in shelters help the infection to spread rapidly. If London is to shed its status as the TB capital of Western Europe, it's vital that diagnoses are made earlier. The Find and Treat programme sees mobile testing units screen around 10,000 people a year, with particular focus on the homeless and those who work with them. Dr. Al Story said that the drug-resistant TB is already a public health emergency.
Drug resistance is a public health emergency. Drug resistance is threatening to take us back to a time when TB was untreatable. We're seeing an increase in the proportion of cases who present with not only resistance to one drug, but resistance to 2 or more of the drugs we have left to treat TB.
In 2012, Public Health England reported the UK had 8,750 cases of TB and said if current rates of infection continue, Britain could have more new cases each year than the United States. Amongst the homeless, London rates of TB are higher than any sub-Saharan African country. And in London boroughs with high levels of immigrants, TB levels are the same as in the developing world. Dr. Vanya Gant is Clinical Director for Infectious Diseases at University College London Hospital. He said the rise in drug-resistant TB is a ticking time bomb and must be dealt with.
They're very smart bugs, and I think most people think that this was because people tried to treat TB in a half-hearted way. So instead of the bugs dying, they survived and became resistant. And of course, some people don't always finish their course. And if there's one disease where you must finish the course of tablets, it's tuberculosis.
In Europe, TB inflicts direct health costs on governments of more than €500 million and costs an estimated €5.3 billion in productivity losses.